Heart disease is the leading cause of death worldwide. Understanding how to reduce that risk is crucial for a healthier life. This video provides useful information to help you manage the risk of heart disease. Heart disease encompasses a range of conditions that affect the heart, including coronary artery disease, heart attacks, and heart failure. The most common types of heart disease include coronary artery disease, which is a narrowing of the heart's blood vessels due to fatty deposits, arrhythmias, which are abnormal heart rhythms, cardiomyopathy, which is an abnormal heart muscle, heart failure, which presents itself in heart squeezing and relaxation difficulties, congenital heart disease, which manifests at birth, and pericardium, which means issues with the fluid-filled sac surrounding the heart. Heart disease symptoms depend on the type of heart disease. It is important to see your doctor so that you can receive a correct diagnosis and prompt treatment. Here are some symptoms of the common heart diseases we discussed earlier. Let's start here. The most common symptom of coronary artery disease is angina, or chest pain. Angina can be described as a discomfort, heaviness, pressure, aching, burning, fullness, squeezing, or painful feeling in your chest. It can be mistaken for indigestion or heartburn. Angina may also be felt in the shoulders, arms, neck, throat, jaw, or back. Coronary artery disease symptoms may be different for men and women. For instance, men are more likely to have chest pain. Women are more likely to have other symptoms along with chest discomfort, such as shortness of breath, nausea, and extreme fatigue. Symptoms of coronary artery disease can include chest pain, chest tightness, chest pressure, and chest discomfort, shortness of breath, pain in the neck, jaw, throat, upper belly area, or back, and pain, numbness, weakness, or coldness in the legs or arms if the blood vessels in those body areas are narrowed. Next, let's talk about the symptoms of arrhythmia. Arrhythmia, also known as an irregular heartbeat, results from the heart beating too quickly or slowly. Symptoms of arrhythmia include chest pain or discomfort, dizziness, fainting or near fainting, fluttering in the chest, lightheadedness, racing heartbeat, shortness of breath, or a slow heartbeat. Next, we have cardiomyopathy, which is caused by diseased heart muscle. Early stages of cardiomyopathy may not cause noticeable symptoms. As the condition worsens, symptoms may include dizziness, lightheadedness and fainting, fatigue, feeling short of breath during activity or at rest, feeling short of breath at night when trying to sleep or waking up short of breath, irregular heartbeats that feel rapid, pounding or fluttering, and swollen legs, ankles, or feet. That brings us into our next topic. Congestive heart failure, or heart failure, is a long-term condition in which your heart can't pump blood well enough to meet your body's needs. Symptoms may develop slowly. Sometimes, heart failure symptoms start suddenly. The most common heart failure symptoms are shortness of breath and swelling in the lower body. Congestive heart failure is the leading cause of hospitalization in people 65 and up. Remaining vigilant for these symptoms may help increase life expectancy. The next type of heart disease is typically identified at birth. However, it can go undetected until much later. A congenital heart defect is a problem with the structure of the heart that a child is born with. Congenital heart defects may be diagnosed before birth, right after birth, during childhood, or not until adulthood. It is possible to have a defect and no symptoms at all. Sometimes, it can be diagnosed because of an abnormal EKG or chest X-ray in someone with no symptoms. Congenital heart defect symptoms in children could include pale gray or blue skin, swelling in the legs, belly area, or areas around the eyes, and shortness of breath during feedings, leading to poor weight gain. That brings us to pericarditis. Pericarditis is swelling and irritation of the pericardium, a thin, sac-like tissue surrounding the heart. Chest pain is the most common symptom of pericarditis. It usually feels sharp or stabbing, but some people have dull, achy, or pressure-like chest pain. Unlike pain from a heart attack, chest pain from pericarditis is usually a sharp, stabbing pain. Now that you know what heart disease is and how to identify it, let's discuss how you can avoid the risk of heart disease. Heart disease develops when there is damage to all or part of the heart. A problem with the blood vessels leading to or from the heart, a low supply of oxygen and nutrients to the heart, and a problem with the rhythm of the heart. In some cases, there is a genetic cause. However, some lifestyle factors and medical conditions can also increase the risk. Some modifiable risk factors include obesity, sedentary lifestyle, smoking, alcohol abuse, diet, and stress. To some extent, diabetes and high blood pressure are controllable factors as well. Factors such as age and hereditary traits are beyond our control. Now that we know about heart disease and the risk factors, how do we prevent it? Your lifestyle is your best defense against heart disease and stroke. By living a healthy lifestyle, you can help keep your blood pressure, cholesterol, and blood sugar levels normal, and lower your risk for heart disease and heart attack. Incorporating a physical exercise routine into your daily schedule, choosing healthy food options, and avoiding unhealthy habits, such as smoking and excessive alcohol use, will drastically reduce your risk of heart disease. Managing stress, attending regular health checkups, and staying on top of health conditions will also reduce risk. Deciding to reduce the risk of heart disease by modifying your lifestyle is your choice to make. This video discussed heart disease and its various types. We covered how to identify the symptoms of heart disease, such as chest pain and dizziness, and some of the common risk factors associated with the different types, such as smoking and obesity. Lastly, we discussed how to prevent the risk of heart disease by making healthy lifestyle choices like eating healthy and exercising. We hope you enjoyed the video, and if not, hopefully you at least learned something beneficial to you. Thanks for watching.